We'll ask everyone to take a seat. We'll get started, please. Good morning. This is the daily public briefing for the COVID-19 novel coronavirus. My name is Brian Beam. I'm the parish administrator for the Calcasieu Parish Police Jury. And we have a lot of good information today, like we have been each day, but as everyone knows, this situation is evolving, and we will have our standard reports from some of the faces you've come to see at each of these, but we also have some new ones today. With the different declarations and executive orders and such coming from the state and federal level, it impacts a lot more people, and it's there's a lot more than just the medical questions. So we appreciate everybody being here today. We've got a lot of good things to cover. I'll get right to it. I do have a request for anybody speaking today, because this is being filmed live and we have an interpreter. Please stay behind the podium for any of your comments or answering any questions. Thank you. And at this time, I'm going to ask that we start off with Dick Grimion. The Police Jury's Office of Homeland Security and Emergency Preparedness is the coordinating agency in these kind of events, and Mr. Grimion will give us an update from his end.
Thank you, Brian. We don't have much to report today from an operational standpoint. We're still in the preparation mode for the most part. Our medical team, our ESF-8 team, is meeting every day and planning out what might happen during the day. I will say, though, a couple of things. Most of the activity is centered around the New Orleans area now, but it is kind of creeping our way a little bit. Today, the state announced that at the Bayou Signet, there are 8 cabins occupied by either patients that are under investigation for COVID or COVID positive patients. Closer to home here at Chico State Park, there are 17 cabins with the same type of persons in them. That's all the information I have. If you need something further on that, check with DHH. One other just interesting item that I picked up on a call. Calcasieu Parish had 645 new applications for unemployment over the last couple of days. So that's about all the general information I have. Thank you.
Thank you, Dick. We'll next move on to Dr. Lacey Cavanaugh. Let me just say, on behalf of all the folks represented, parish cities, the medical community, Dr. Cavanaugh, who is the Region 5 Director for Office of Public Health, which is a state agency under Louisiana Department of Health. She has done an excellent job. She's kept us informed. She's very knowledgeable. She is a great communicator. She's very tireless. Our big worry is that there's only one of her, and I don't want her to burn out, but we really want to take a moment, and I want to thank you, Dr. Cavanaugh, for all your work, and she's got an update from us. And she will also be followed. We have and she'll introduce, we have another element of this that we need to report on. Thank you.
Hi, thank y'all for that. A few new updates today. One is, of course, I'd like to go over the latest case numbers, because, of course, everyone always has that question. So as of 9:30 this morning, Louisiana now has 240 cases of confirmed COVID-19. Most of those, as you can see by the map behind me, are centered still in and around New Orleans and Shreveport areas. And as of 9:30 this morning, we still have no confirmed cases within Southwest Louisiana. The state lab has continued to ramp up testing pretty substantially. As you can see now, 597 tests have been run across the state at the state lab. We now are starting to be able to characterize the cases that we do have and break those down by age group. We think that over time you will continue to see more information about who and how severe the cases are as we are able to compile that information. So on the website, there's a new tab right at the bottom of the map that you can can click on that will give you sort of some demographic information about the cases that we do know so far. Those that and that information will be changing as we gather more and more information from each of the cases that we know about. We have 13 parishes across the state that are now involved and have at least one case, and we have unfortunately increased to 5 deaths within Louisiana, and that 5th one just came out this morning. The parishes are also listed. We also have found out that now there will be a way, per the sanitary code, to actually collect information about negative tests. So on the private side, if you get tested via, say, LabCorp or Quest or not using the state lab, we will eventually be able to get that information back, and it will be reportable to us whether that test comes back positive or negative. So that will give us a lot more information going forward about how many people within the community are tested, which is another important point that I wanted to make today. We all wish that we had as many tests as anybody in the whole United States wanted to be able to use on testing for COVID-19 available today. Although there are a lot of people working really hard to make sure that we get more supplies and more equipment, you have to understand that there are 50 states, and everybody needs these things at the same time. And so we want to make sure that people know that the treatment for COVID-19, if you have a mild case, is really the same whether you test positive or whether we feel like you have the symptoms and we don't have a test available, and we ask you as a medical community to go home and isolate yourself. And so I want people to understand that you don't get any different treatment if there is not a test immediately available. As you are seeing across the state, there are lots of sites that are popping up that are doing drive-through testing, and some of those, for example, in Baton Rouge, I think they had a little bit of a strain on the testing supply kits, right? And that made the news. So we want to make sure that as a medical community, we use every piece of equipment and every test that we have to the best of our ability. And over time, that situation, I know there's a lot of frustration out there about testing. It will improve. It will improve over time as the supply catches up to the demand. This has just happened so incredibly fast, as you know. So just wanted to communicate that. Also wanted to communicate that social distancing that you keep hearing about, so staying away from other folks, people sort of feel like this situation is so out of our personal control, right? We're used to having control of all those things around us. And this situation, when we're told to stay home and to isolate ourselves, can definitely be stressful for a lot of people. But what I want people to understand is that social distancing is our protection. That is our action. That is what we are doing, not only for ourselves personally to keep ourselves healthy, but for our community. And so be strong. I know that it is challenging. This is personal, and we all have a huge part to play. And if at the end of the day, once this thing has kind of moved on, if it ends up not being nearly as bad as what everyone keeps talking about, I think that's great, because what that means is that the things that we're doing now have worked. So thank you. I have a few other folks from our medical community here today to talk about some of the specific efforts and things that they are doing within the medical community. These are the folks who are on the front lines of this pandemic. And so I'd like to ask Dr. Jordan to come up and give a few words. He is the CMO of Lake Charles Memorial Hospital.
Good morning, and thank you, Lacey. The basic principle in healthcare is obviously first do no harm, and historically that has been about patients. But also I think we need to keep in mind that we have to keep our healthcare delivery system functioning, because if we don't, then we are indirectly causing patient harm. And I think everything that we're trying to do is making sure that we not only keep patients safe and do the best we can, but also ensure the integrity and functioning of our healthcare delivery system. Dr. Adams, the U.S. Surgeon General, got on TV this morning, I think made some statements that warrant repeating today. We have a 2-week window nationally and obviously in our 5-parish area to make a change here. We've got a 2-week window. And basically he says we're either going to follow the experience of countries that had some bad outcomes, or we're going to follow the trajectory of countries that have not. And basically, the three things, and like Dr. Cavanaugh said, these are simple things, simple in theory, but to put into practice, we've got to keep having awareness. First and foremost is that social distancing, the 6 feet rule. Second, hand hygiene. Can't say that enough. And last, wiping down common surfaces that we all come in contact with. So disinfecting and sanitizing those surfaces. So I just wanted to reiterate what Dr. Adams had said this morning. It's very important. Currently, testing in the community, we are certainly limited, and we're testing based on clinical decision-making by the primary care base. We feel like the primary care physicians need to be intimately involved. They need to know what patients that are under investigation or that are concerned about, where they can be looking for a test result. So we feel like the primary care base needs to be involved in making referrals to our testing center. Again, the testing center turnaround time, we're screening patients. If they meet criteria, we're submitting testing primarily through the private vendor avenue, but we're still experiencing about at least a 3 to 4 day turnaround time. So I'm sure we'll have questions later. I just want to have those initial comments, and we can take questions at the appropriate time. But thank you, Dr. Cavanaugh.
I would also like for everyone to hear from Tanya McGee, if she would come forward and give just a few words. She is the Executive Director of our Imperial Calcasieu Human Service Authority.
Hi, thank you, Dr. Cavanaugh. I wanted to talk to everybody today a little bit about behavioral health, and everyone has experienced increased stress and anxiety. Currently, behavioral health services in our area are still fully functioning. We are limiting face-to-face contact with a lot of our folks. The state is looking to get Medicaid approval for phone therapy as opposed to face-to-face. We're implementing statewide and in Southwest Louisiana more telemedicine and telehealth. We encourage anyone who is currently receiving behavioral health services, if they're currently on behavioral health prescription medications, to be reaching out to their providers and reaching out to their prescribers. Right now, prescribers are providing 3-month refills. They're doing more things telephonically. So I think it's good to plan ahead in case in such time they would have to be isolated. In the general public, for those that aren't necessarily already receiving any type of mental health treatment, just kind of keep in mind that this is a heightened time, that there is going to be high levels of stress and anxiety, and making sure that you are able to recognize those symptoms within yourself. All of the people in this room, heightened anxiety and stress, let's watch out for each other. Irritability, differences or changes in eating habits, sleeping behaviors, increased alcohol consumption, those are all warning signs. So take heed with what you're doing within yourself and your home. Access to information is great, but sometimes too much of that access can increase levels of stress and anxiety. So if you are experiencing high levels of anxiety in response to this, then maybe limiting, not sitting in the background with CNN on TV all the time, limiting that intake. That's important as well. We are going to be establishing at Imperial Calcasieu a phone line to where folks can call in. This will be done within the next 48 hours, to where people that are experiencing heightened levels of anxiety, even if they're our clients or not our clients, to be able to call in and speak with licensed professionals. We're going to be implementing that within the next 48 hours, and so we'll give that information out as soon as we have that set up. But I very much encourage everybody to watch out for one another, surround yourself with individuals who help calm you, and we'll give more information as it comes available for resources in the community.
All right, and lastly, on the medical side, I'd like to bring up Ms. Javon Muhammad. She is the CEO of SWLA Center for Health Services.
Good morning. So SWLA Center for Health Services provides primary medical care, dental care, and behavioral health services to the community. Local guidance, state guidance, federal guidance has been to contact your primary care provider before you can access a lot of the testing sites for screening. We would like to offer those who do not have a primary care provider the opportunity to have a primary care provider through SWLA Center for Health Services. If you are in need of a primary care provider, you can call us at 337-439-9983. Because we become your primary care provider does not guarantee that you will receive testing. As you've heard from the people before me, we have limited testing. That includes SWLA. We have limited testing at our centers, but it does mean that we can give you the appropriate guidance to be able to go to the next level of care. So again, if you're in need of a primary care provider so that you can be referred to the services that were mentioned before for testing, possibly call us at 337-439-9983. At this time, we are still offering regular services. We are using a lot of telehealth. Our dental services have been limited, so if you are scheduled with us now, you may receive a cancellation for just routine dental. We're limited to emergency dental services, as are those dental offices throughout the state, and our behavioral health services are still up and running. Thank you.
All right, so in closing, stay strong and be confident that the measures that we are doing today, at the end of the day, are going to save lives.
I want to thank Dr. Cavanaugh and the others who spoke. We had a really good meeting yesterday between elected officials and a lot of representatives from the medical community. Very helpful, very effective. And we want folks to know that the right groups are talking. We keep learning new things and we bring in people as needed. And appreciate the coordination from Dr. Cavanaugh. As you're aware, we have a lot of public agencies, medical agencies, local government, law enforcement that have been commenting. Later, in just a few minutes, you'll hear from some of the private sector. One of the things that we want to make sure we don't overlook is the group that's called NGOs, non-governmental associations. Commonly referred to as not-for-profits. They're very active in this. And we have a speaker today that represents Director of United Way. Executive Director Denise Durrell is going to update everyone on the efforts related to the 211 service. And she's got some very interesting numbers for us and some help for public who are looking for a little guidance and how to direct them to the right folks. So at this time, I'm going to ask Denise Durrell with United Way to come forward.
Good afternoon. I just am here to remind the general public that 211 still remains the hotline if anybody has any needs or any questions, non-emergency related to the virus. Our operators are working 24/7, 365 there to answer any calls that you may have. And if perhaps that you call in and you have a question that hasn't been asked yet, please know that we are in direct contact with the Department of Health and the CDC. And so what happens is when a question comes in that we don't have a relatively answer for, we turn to that group and they immediately get that response back to us. So it is in real time. So we just want to remind everybody it's a simple landline or cell phone number, 211. You can also reach us via text. You can text 898-211, and I'm happy to report at this point that as of this morning, we have had over 7,000 individuals in the state of Louisiana actually call and talk to a live United Way 211 operator, and we've had over 15,000 people use a device to text in to ask questions and be directly linked to the Department of Health and CDC. So just want to again remind everybody that we're here to help in any way that we can, and again, those non-emergency calls, we're ready to help 24/7, so thank you.
Thank you, Denise. Very helpful. And look, everybody who's spoken is still available. We will have a question and answer part at the end of this report. At this time, we have a couple of members of our executive policy group. I know we say this at each one, but just a reminder, the local coordinating leaders you have, the elected leaders, made up of the police jury president, Calcasieu Parish Police Jury, every mayor in Calcasieu of the 6 municipalities, and the sheriff. And so we are constantly talking, meeting, and discussing these things. So we want to hear from a couple of those folks, and the Calcasieu Parish Police Jury President is Tony Gilroy, excuse me. I got to get that right. And he's going to come up at this time.
First of all, I'd like to send prayers out to everyone and their family during these times as we go through this invisible war as we go through here. I'm Tony Gilroy, Calcasieu Parish Police Jury President, And I just want to thank everyone for being here. I just wanted to touch on a few things that the police jury services have changed. Number one, the Burton Complex facility and the Calcasieu Emergency Response Training Center is closed. Mosquito control, animal services, human services, public transit, and the Office of Juvenile Justice Services, including the Mark Center, is open. The solid waste convenience centers, parish parks, boat launches, and RV and tent camping facilities are all open. Calcasieu Parish Police Juries meetings have been canceled until further notice. Waste management, garbage services are running according to schedule. And stay tuned to our website and our Facebook page for more update services. And again, thank everyone for coming here.
Appreciate that, Tony. Tony's been working very hard during this and come to several meetings. We also have Mayor Nick Hunter of Lake Charles, who will come up next for some comments.
Thank you, Brian. Good morning, everyone. I just want to stress again a thing that Brian said a moment ago, and that is that this group of leadership in Southwest Louisiana, both from the medical community, the private sector, and the public sector, is working together very cohesively right now. The decisions that are being made are made with a lot of thought, a lot of care, and people are not working in silos. People are working together, and I think that's really going to be for the benefit of this entire community. The City of Lake Charles continues to be open for business with certain curtailed services, as we have already mentioned. There's really no update there. I want to say that over the last couple days, I've actually received more calls from local citizens wanting to help rather than needing help, and that is a very refreshing thing. I think we have a very resilient population here in Southwest Louisiana. We have people that live here who care about their neighbors, and people want to help right now. This is an interesting situation, and it's, again, different from a hurricane where perhaps you might call people together as a group to come help. I want to reiterate a couple things also that Denise Durrell said. 211 is an amazing resource. We want to stress to the public 211 can do some wonderful things. If you are out there and really even in a non-emergency setting, whether we were going through this or not, if you found yourself in need of food, shelter, or some other basic services, 211 can point you in the direction of where to receive some of those services. We have a lot of people hurting right now in Southwest Louisiana. The immediate need and the immediate attention, rightfully so, is on our health and our safety, the medical community. But I also want to stress that there's a lot of small businesses out there that are hurting right now, and the pain will probably get worse over the coming weeks and months. A lot of employees right now in Southwest Louisiana who are hurting. So again, for those people who want to help, a very simple thing you could do is try and support some local businesses if you can. We have asked local businesses to abide by some of the decrees, really all the decrees of the governor, and so far so good. But there are a lot of local businesses that are still open on a limited basis. Try and support those businesses if you can, and by supporting them, you are also supporting the employees who have to go home and feed their families and pay rent and pay the light bill. If you find yourself sitting at home again just wanting to do something, I can't stress enough the need for nimble resources in a situation like this. Perhaps this week we need food and sanitizer, but maybe 3 or 4 weeks it's going to be help for small businesses. There are 2 funds that have been set up. One by the United Way of Southwest Louisiana, and if you wanted to donate to that fund, it's www.unitedwayswla.org, and also our local community foundation, www.foundationswla.org. So we are a community that wants to help our neighbors, and there are some opportunities to do that right now. Thank you.
Thank you, Mayor Hunter. I'm going to shift now to have a representative from law enforcement. I know Sheriff Mancuso is on his way up. With a lot of the executive orders and other things, and the scope of this continues to grow, more questions come up about community safety and so forth. It's not just medical related. So we are very glad to have Sheriff Tony Mancuso here today.
Good morning. Thank you. You know, there's so much uncharted territory that we're in right now. This is not the normal disaster that we're normally able to manage and navigate through. So it is a little different. But I am confident that we as leaders are always on the same page, and we do know how to manage disasters, regardless of what that disaster is. Although this is new and uncharted territory, what brings me comfort, and I hope people understand this, is we live in the United States of America, where we have the brightest, smartest anywhere else in the world. In other words, people come from all over the world and the country to study here. Our doctors, people of the medical profession is specifically what I'm talking about, come from all over, every country, to come to the United States to learn and to teach and to get medical help and attention. So I am 100% confident that our medical profession, we have the best and brightest, and they're going to figure this out sooner than later. And we, as a community now, just have to relax and rely on them. We're not going to hide anything from you. Your public officials, this policy executive group, we're not going to hide anything from you. We're going to tell you exactly how it is and how we feel and what we think needs to be done. And we're going to ask you to cooperate, and you have. And that's what makes this so refreshing and easy for us. You have done everything we've asked of you, just like you normally do. We have had no increase in crime. We've had no unexpected issues as a result of this. None. Things have been as normal for me as they could be. And I say that it's not normal, but as from a crime standpoint, it is. So I've been asked, probably the big question is, are you going to institute a curfew? And listen, I've talked to the other agencies and I've pondered it. This is not like a storm where we have downed trees, we have loss of electricity, we have our population displaced. None of that has taken place. We're here to watch over each other. So I can see no reason, no logical explanation why we would do that at this time. Nor do I foresee that. But we have that option. We always have those options available to us. But no, we do not see any foreseen future reason to implement any type of restraints like that in our community. Things are fine as far as on a criminal level. We've taken our school resource officers, we've dispersed them to help in areas, for instance, like our grocery stores. We've just put them in parking lots, just sitting there. Again, we sometimes and I would like to touch on that a little bit, our social media rumor mill just sometimes fuels things that we really don't need and panic that we really don't need. I'm telling you, things are as calm here as they are on a normal day, other than us personally. Our stress level is all a little higher. Our anxiety is all a little higher, and it should be. It should be a concern to us. But we're going to be just fine. And the grocery stores have told us over and over, we have plenty of groceries. If everybody just relaxes and calms down, we will get our supplies back up and stocked. We're not going to run out. But people panic because somebody gets on social media and says, all the toilet paper comes from China and it's quarantined. And it's just not true, So we're going to tell you, I tell you what, if you see us panic, then it's time to panic. And we're not going to panic. We are going to handle this. And we're going to help you through this. And we're going to all get through this. It's going to make us as always, it's going to make us a better, stronger community and a stronger nation. It's just one of those bumps in the roads that we're going to have to deal with. But I'm going to say it again. I think we have the best and the brightest of anywhere in the world that are dealing with this, and they're going to fix this. It's just we got to do our part. So, again, I could repeat some of the things that our mayors have said and our other leaders have said, but we just need to take care of those now who are going to hurt the most. Some of our small businesses, our restaurants, they're still open for takeout. Go visit those places, call in orders, do what we can to help them. That's what we can do as a community to help. Everything else is going to take care of itself. So we need to help those people and let them and lift them back up. Or when we do reopen, make sure we visit them and help them through this, because they're going to be the ones that hurt the most, our small businesses. So I'm available for questions when this is over, but Brian, unless I didn't touch on something that you wanted me to, thank you for letting us speak today.
Wise words from Sheriff Mancuso. We thank you, Tony. And we do want to encourage everybody. There's a lot of positives here, and I'm a native. I'm from here. I've lived here most of my life, and I'm very proud to see how people are taking this seriously, using good judgment, and having faith in each other that, hey, it's going to be okay. And we're very glad to hear that from the law enforcement side that it's not so much different than we thought. We also want to thank the several police departments with all the municipalities and others involved in this, and they're taking care of the public. We also want to ask District Attorney John DeRozier to come up briefly. He wanted to give an update on court proceedings. Obviously, a lot of the legal things that go on, people are asking some questions, and we appreciate him being here today.
Thank you, Brian. First of all, relative to the family and juvenile court system, the family and juvenile courts will hear only emergency cases until notified in the near future. So if you are involved in any proceeding in the family or juvenile court, you will not be going to court anytime in the next couple of weeks, unless it's an emergency case. If you have any questions about that, please feel free to call the family and juvenile court at 337-437-3363. The Calcasieu Parish District Attorney's Office is in fact open. We would encourage anyone that has any business with the District Attorney's Office to please call instead of coming in unless it's absolutely necessary. Don't worry about having to come in to the DA's office directly for a traffic ticket or anything like that. Call in. Our phone number is 337-437-3400. If you have any concerns about anything you're involved in the criminal justice system, call us and we'll answer your questions. Thank you.
Okay, we've got two more speakers today. They both are dealing with the business side and industry side of things and those impacts. Several of our earlier speakers alluded to this. We are aware that a lot of businesses are impacted, and we want to hear a little bit more from that. Our first speaker from that side of things will be R.B. Smith with the Southwest Louisiana Economic Development Alliance. They just had a really good conference call yesterday with people in the business community, and we'd like to hear an update from that conference.
Thank you, Brian. Good afternoon. My name is R.B. Smith. I'm the Vice President of Business and Workforce Development for the Southwest Louisiana Economic Development Alliance. Earlier today, we heard from Louisiana Economic Development that Governor Edwards has requested federal assistance from the Small Business Administration for the Economic Injury Disaster Loan Program for businesses that were impacted by the COVID-19 coronaviruses. SBA approval is expected this afternoon. These are long-term loans of up to 30 years to help businesses recover from the impact of the coronavirus. The Southwest Louisiana Economic Development Alliance is conducting an online survey to gather information from businesses in the region on the impact of the COVID-19 coronavirus. Please go to our website, www.allianceswla.org, and click on the COVID-19 information button in the middle of the home page. It will take you to the COVID-19 page, and then click on Take the COVID-19 Business Survey title, and it'll bring you to the survey. We need every business to respond to the survey so we can compile the information and bring it to our state and federal officials to where we can request relief when it becomes available. The COVID-19 page on our website also contains downloadable flyers on safety precautions and web links to reliable public health care and government agencies for accurate information. Also, for those businesses impacted where they've laid off employees, we want you to send those employees to www.laworks.net to apply for unemployment online. We will be back with other information as it becomes available, and we thank you for this opportunity to speak. Thank you, Brian.
Thank you, RB. Very helpful. Our next speaker is Jim Rock with the Lake Area Industry Alliance, or LAIA. Our petrochemical industry here, of course, is a huge economic sector not just for the employees, direct employees, a lot of contract and their families and so forth. So we need to hear a little bit more from how they're handling this issue, and we appreciate Jim Rock coming and speaking on behalf of the LAIA.
All right, thank you, Brian. Good afternoon, everyone. Yesterday at this meeting, Dick Grimion went over a summary of about 10 or 12 different things that all the industries are doing to protect their employees and maintain safe operation, and all those practices are continuing to take place today. They include things like restricting travel, restricting visitors, taking additional sanitizing and cleansing practices within the plant, and protecting the control rooms and the integrity of that part of the facilities. We have been having and are continuing to have conference calls, video conference calls, and things like that amongst all the plant managers, so that if there's a best practice out there that somebody knows about and somebody else doesn't know about, we're sharing those best practices so everybody can be on a level plane as far as protecting their employees, and including the safety and health of the employees, the contractors that are out there, and the general public. So, and it's very important that we continue to operate. I've heard about jobs and unemployment, things like that, but keeping the plants operating is keeping over 7,000 people, direct employees, working and generating wages and salaries and benefits and things like that. It's also tens of thousands of contractors and service providers and things like that, and they're receiving income so they can help support the local businesses like RB was talking about. My personal home, we had plenty of groceries, not too much, but the right amount of groceries in our household. But we got something to go last night from a local restaurant. We're going to do that again tonight and probably for the foreseeable future, and may not even touch our groceries for the next couple of months. I'm not sure. But we are producing products that are very essential to the infrastructure. We're producing electricity, we're producing fuel for the vehicles, we're producing feedstocks for products that clean and sanitize things that are more important now than ever. Finally, Greg Bowser, who's the president of Louisiana Chemical Association, has been in contact with the governor, urging him to protect the integrity of the industries and keeping us operating because of the important role that we play in the health and safety of the state and the nation. Thank you, Brian.
Okay, thank you very much, Jim. Obviously, a lot of different people covering a lot of different topics spoke today. We want to go ahead and wrap up the last part of this session with any questions. I would ask that anybody who has a question, please wait till you get a microphone. We've got a couple of folks in here that will bring it to you so that everybody watching can hear the question as well as the response, and depending on the question, we'll ask a particular speaker or speakers to come forward. So, now, are there any questions at this time that we need to address? Yes.
With regard to the people who work at the industries, we've received some concerns from our viewers about when it rains or when there's lightning, that suddenly, and this may mainly pertain to contract workers, that social distancing goes out the window and suddenly they all rush together to get out of the rain or the lightning. Can you address that? I mean, what, if anything, else can be done to protect those workers from each other?
Jim, if you're going to try to answer that, you mind coming to the podium so they can see your answer?
All right, thanks for that question, Teresa. Yeah, all the plants have procedures in place to maintain, as I said before, the safety and health of employees, the contractors, the vendors, and service providers and things like that. They include lightning alerts and what to do and seeking shelter during lightning alerts. And I can't really speak to the different industries because, we have 23 different members of our organization. All of them have a different scenario as far as what kind of shelters, the size of the shelters, and things like that they provide. But we do have procedures that protect people not only from coronavirus, but also lightning and other hazards that are out there.
Thank you.
Sure.
Last night we received complaints that, last night we received complaints that at least one local bar was basically ignoring the directives and that the place was packed. And I don't see the police chief here, but we were told that Lake Charles Police intervened, and I happened to drive by around 11 o'clock last night, and the place was dark. Any reaction to that, or can anyone explain what happens to those who, well, I think somebody's going to have to explain the difference between allergies and, excuse me, my spring allergies are kicking in. But I promise.
Call
But
211.
okay. But you know, what if anything is going to happen to those who just ignore the directives?
I will, I guess, ask either the municipalities here or the sheriff's office, if you want to say that, respond to that. Can you come up? And we'll hear from both Mayor Hunter and Sheriff Mancuso.
Well, we basically have a mechanism for that. You know, we did get a directive. As a matter of fact, while we were sitting here, I got a text from the state fire marshal about some policy that we're going to use too for that same for those policies that are being violated. What we're going to do is, and this is what the governor's office suggested, is go out there and give them a warning. Explain to them that they're ignoring the governor's order. And then if they refuse to abide or comply, then there is a mechanism where we're going to do a report and either submit it to the health department or one of the municipalities who can pull their occupational license. There will be a mechanism to deal with this. So we're navigating through this. This is new charter territory for us too. So we're trying to come up with a mechanism to figure out how to legally deal with the issue at hand.
Your inclination be more to break up what they're doing, or I understand the penalties may not be that severe?
Well, you know, the best way I can answer this is, you know, we're navigating through it and trying to figure out the best practice. We're going to go there and tell them that they're violating the governor's orders, and then we're going to leave. And if they don't comply and we have to go back, then we'll figure it out from there. So. I don't know that there's a criminal penalty that we can issue at this point, but we're working on that. So I think that's what we're trying to navigate through right now.
I think the sheriff, I agree with everything the sheriff just said. I would also say the incident that happened last night, the business was compliant, and so they were very cooperative with law enforcement. And that's what we want. We want businesses to be cooperative and compliant, and I believe that in the vast majority of cases, that's what we're going to see. The only other thing I would add is this was a decree of the governor, and I encourage businesses to remember that they have ATC licenses, they have video poker licenses, they have health department licenses, all of which are administered by the state government. And I have some of those licenses, and I would not want to be defying a decree of the governor at this moment in time. So we encourage businesses to remember that. I believe the majority of businesses in Southwest Louisiana, vast majority, understand the situation, and they have been compliant and will continue to be.
Think that someone who defies the decree of the governor could actually lose their license over it?
I don't know an answer to that, but I have some of those licenses, and I would not want to be defying a decree of the governor at this moment in time.
Any other questions?
I mean, if no one else has questions.
Go right ahead.
You know, viewers keep sending us questions. Does anybody know if mosquitoes can transmit this virus?
I'm actually going to ask Assistant Administrator at the parish, Dane Boland, to come up. He's actually very active right now in having our mosquito control staffs going out. It's just coincidental, it's springtime, and I think that's a good question that he can address.
Thank you, Teresa. We've got that question actually a lot over the last couple of weeks. And from what we know at this time, and I might defer to Doc over here, and she's shaking her head, so I'm going to team up with her. It cannot be transmitted through the mosquito bite. But we are spraying. Our trucks are out on the road tonight. Hopefully the weather's good tonight. We can send a couple planes up and start there.
Anything else, Teresa?
I think I'm good. Some of the questions I'm getting, I'm sending into you. I mean, we got a complaint about a local facility that takes care of children. Someone who said that, you know, she has nursing expertise concerned about children and their caregivers in close proximity, and talking about around 150 people. As we get these types of complaints, rather than necessarily calling them out in public, is there someone in particular you want us to direct these to, or the citizens?
Well, I might need a little help on this one. I believe if I hear your particular question, or this latest one, it may have more to do with the medical side, and that may be a combination of, when in doubt, call 211 and they can direct them. I think that's probably an easy way. And then they are every day in close contact with Office of Public Health. And let me say, you brought up the medical community. I don't know that it was said earlier, but in meeting with all of the representatives from hospitals yesterday and other providers, let's remember all the medical providers. They are subject to getting this as well. And we need them very much right now. And so we need to be very attentive to their needs, and they have to try to rotate out. But just like I think it was said earlier, some of the testing and the equipment and things, although it's coming, it hasn't been as much. There's also issues about medical labor and all of those important things. They are all, like the rest of us, they get burnt out, and if they start getting sick, it gets a little more dangerous. So let's just remember them in this whole thing. Their role is so critical right now. But yes, any general questions, you're not sure where to go, 211, we would ask all citizens to call that number, and they will direct them to the right source. If there are no other questions, we appreciate everybody's time. The next briefing will be tomorrow at 11:30 a.m. here, unless we get any other news sooner. Thank you.